Hello, my name's David Edis. I'm an orthopaedic and spine surgeon. I'm going to share with you today a presentation about non-operative treatment for chronic back pain. So, surgery is not usually required for chronic back pain. This is the good news. Chronic back pain is defined as a pain that has been present for longer than 3 months. And in most cases, there is not a serious underlying cause, but your specialist will take a careful history, perform an examination usually, and arrange selective tests to rule out any serious cause. So where is the pain coming from? Most of the times the pain in the spine is coming from either the bones or the joints or the discs or the ligaments, or even the muscles of the spine. And in most cases, this is self-resolving, but sometimes this pain keeps going. And oftentimes it's just due to normal aging of these structures, or wear and tear of normal life, and we call this degeneration. Sometimes the pain can be very difficult to manage nonetheless, and there may be, in some cases, underlying subtle deformity or an instability that can be found, and if that's corrected, then that can result in relief of your pain. Sometimes, however, the pain can be coming from other structures, and this also needs to be considered. Sometimes it's the blood vessels, or indeed some of the organs, like the kidney, can cause pain that feels like it's coming from your back. And tests need to be performed to assess that possibility. So how can we find the pain? We usually rely on what we learn from the patient about the pattern of their pain to help understand, at least in the initial phases, where that pain might be coming from. We then use our various different imaging tests to explore what's going on and look at the structure and the function of the spine with these tests. The most commonly used test is an MRI scan because it does give very excellent detail of the anatomy, including the nerves, the discs, and the other soft tissues around the spine. We do use CT scans as well sometimes. These are particularly useful for fractures, so after injury, or to evaluate arthritis and deformity. And they certainly help us plan our surgery if that's where we're going to stop. Standing x-rays now include a special test called an EOS imaging scan that's very low dose radiation and can generate a 2-dimensional and 3-dimensional picture of the spine, and help us better understand the spinal alignment and the balance, as well as incorporate that with the pelvis and lower limbs. There are x-rays that can be done in certain positions of the spine, and there are nuclear medicine bone scans that can also add useful information. So what are the non-surgery treatments that are available? Well, the first and the foremost and the most important is exercise. It's not just going for a walk. Often it does involve some sort of exercise that helps to focus the strengthening around your core. And this can be done by a number of different mechanisms, but most commonly these days Pilates is being used, but yoga and Tai Chi are also other exercise programs that can be useful. Some therapists use postural adjustment, particularly to correct some of the bad postures that may have developed with your pain. And of course, there are medications around for pain, but we have to be cautious about how far we go along with those when we're dealing with chronic pain. Some therapists use needling techniques, including acupuncture or dry needling, and these can be useful in short term to help with pain. Some therapists use manipulation of the spine, and they use deep tissue massage, and again, they have been shown to give short-term relief, but in chronic pain, that isn't always what we're after. There are other types of injections that your doctor may order or specialist may order, and these usually involve a local anaesthetic and often a steroid component. We can direct those at the facet joint or to the medial nerve branch that goes to the facet joint, or indeed we can inject it into the spinal canal through the epidural or nerve root injection. There are also injections of ketamine, which we call an infusion, and patients are sometimes admitted to try and dull down the pain with this very powerful drug, and this is usually used by pain specialists. There are newer techniques around, such as neurostimulation. These can be either field stimulation or a centrally placed spinal stimulator. So often I'm asked, can pain just be in my head? And there's no doubt that most pain will begin with some sort of tissue injury or damage, but for some people the pain remains even after we know that the normal healing has been completed. The nervous system that transmits these pain messages to the brain is complex, as you can see in this picture, and we're still learning about how chronic pain does work. We certainly know that pain is contextual, and what that means is it can be influenced by the other aspects of our life, including how we're feeling in ourselves, our general mood, our life situation and life stresses, such as when we're going through financial hardship, or we've got conflict in our relationships, or we lose our job, or we have work conflict. So we sometimes need to address these issues at the same time as we're treating the pain. And a counsellor or a psychologist can be very helpful in this area. I like to think of them as a life coach to help us through these difficult times. As treating doctors, we need to be very sympathetic to patients with chronic pain, because it can be very distressing and difficult for patients to manage and see a way through it to a life that's somewhat normal while they're still experiencing persistent pain. Thank you for listening.